The industry as a whole in healthcare is facing a shortage. Those young people are the future workforce. I see opportunities for them. I see hope.
Indianapolis Public Schools is the largest school district here in Marion County and really across the state. We serve about 31,000 students across all of our schools, ensuring that they are able to have the knowledge, skills, competencies, and mindsets to go on to live the life that they choose to live. And so we wanted to ensure our students were getting real work-based learning experiences. So the fellowship came from a lot of conversations with IU Health around how we might partner to ensure our kids are getting a strong academic experience in school, but then this really robust work-based learning experience with IU Health.
IU Health has about 40,000 employees, hospitality, cooks, logistics, warehouse, all the way to a medical assistant, 1, 2, 3, surgical tech. We want to be a part of the strategies in the community that are supporting young people who are interested in healthcare career. Crispus Attucks High School is in the healthcare district. It is a college and technical education center with a healthcare pathway. So it just seemed like a natural fit for us to work with them to see how we can encourage and invest in as many young people who want to consider a healthcare industry career, but also consider that career at IU Health.
We have a strategy that's really focused on K through 12. It's about exposure. It's just about awareness. It's about really helping them see more than just what they see, in the media around a nurse and a doctor. You've got finance, you've got HR, you've got marketing. You have all of these things that you don't stereotypically think about. And so a lot of that middle school exposure is about just helping them see how vast a health system is and the myriad number of opportunities afforded. And then as we transition to high school, it's really about some tangible learning opportunities.
This is a 3-year-long fellowship, and so they spend time with professionals who are in that field. They are shadowing them. They are on the floor at the hospital. They're not just sort of being churned through with like a group of students who do this for 6 weeks and then on to the next. It's quite a length of time, again, for students to get a really in-depth understanding of what they want to pursue.
The path is no longer a straight, direct path. Oftentimes, young people particularly those who may not have a lot of support, what they really need is for us in the community to come around them and show them how to connect the dots to the career path that they want.
I think so often for a number of our students, they are coming from a family where they will be the first generation student. They're coming from an under-resourced community. They're students of color. They are an immigrant student. Like so often they don't see themselves reflected in the different industries or careers they might want to pursue. A number of them have limited opportunity, but it's not limited potential and it's not limited talent. And so the power of this partnership, again, is our students getting to see people who look like them, who are pursuing these pathways and who are being successful or who come from shared and similar backgrounds. It gives our students a level of confidence and belief in themselves that otherwise I think it would be a struggle for them perhaps to have.
There's so much data and research that shows that these sort of early interventions and early opportunities for learning increases confidence. I would say that these students, and the data bears it out, they come into the organization much more adept at the roles that they're settling into relative to someone that we would hire from off the street.
This program has helped me meet with mentors who have shaped the person that I am today, and I am super excited about my future because I know it's bright.
Being in the program alone is a reward. With the experience you gain, with the knowledge you gain, with the networking, with the people you meet, that alone is a reward in itself.
I feel like most people here have been set up for success because with this program, you get to go out there with so much more confidence than you probably had.
You're going to see a variety of professions: respiratory therapists, art therapists, doctors, nurses.
Got to see human organs like a pancreas. I got to work with little kids who had sickle cell. It's an eye-opener, honestly.
They're going to set you up with the tools, and then they're going to walk you with the tools until you get to your goal.
Because of the success of the Crispus Attucks partnership, I have regional presidents saying, we want something, we want our version of that, we want this, because there's no shortage of opportunities.
We're really excited to be working in this space with IPS at Crispus Attucks High School because we do see this as a huge return on investment for the community, but for IU Health as well.
We think the IU Health Fellowship program is a model that we certainly want to replicate with other industry partners in other fields. We also know when we think about the talent and workforce needs of our community, they are significant. We just believe we are helping to solve a real talent pipeline challenge that Indiana and Indianapolis is experiencing. And so there is a benefit there, particularly for the students that we serve, who we know many of them will stay in our community. You can really create a generational ripple with one opportunity. To pour into them now is an investment that will pay dividends into the future.